Aloha and mahalo. I'm Laura Arcibal. I'm currently serving as the State Telehealth and Healthcare Access Coordinator at the Department of Health. I'll be providing a state update on telehealth. Currently, I'm based in the Office of Planning, Policy, and Program Development. Our office is led by Lauren Kim, who's the Chief Policy and Legislative Coordinator. We are responsible for department-wide government relations, public policy, strategic planning, and special projects such as telehealth and medical aid in dying. Our core strength in OPPD, in my opinion, lies in our team. The work that we do on various projects requires us to be nimble enough to adapt and innovate when and where needed, and with what limited resources we have. I will point out that what binds me to many of my public health colleagues is the foundation of our work in addressing health disparities in everything that we do. Health disparities, as you know, is linked to social, economic, and environmental factors. These differences in groups of people who have systematically experienced greater obstacles, such as access to food, housing, higher education, and jobs, to name a few, and in this case, healthcare. Telehealth is a part of that solution. So you can find more information about OPPD on our website. Now today I'm here to talk about my kuleana, which is telehealth, where we've been, where we are, and what's next. I hit the ground running in June of 2017. Being new to the telehealth space, I worked closely with experts to plan and coordinate a statewide telehealth summit that was slated for October of that year. Our core planning group included the University of Hawaii Pacific Basin Telehealth Resource Center, Area Health Education Center, Queens Hospital, and Wilcox Hospital, to name a few. There were over 200 attendees from various sectors across the state, and every county was represented. The major objective up until that point was to inform stakeholders of telehealth policies in the community. The second objective was to align stakeholders by identifying shared ideas, needs, and thoughts. What's key for this summit is that it culminated into several small facilitated groups where attendees were able to describe their perfect telehealth world. It included interstate medical licensure compact, government enforcement of parity reimbursement, unified credentialing and privileging between health systems, broadband connectivity, as well as interconnectivity between systems. You can take a look at the Telehealth Summit final report on our website for further information. There's also access to a summary of the report there as well. In 2018, thankfully, with the summit and engaged stakeholders, we were able to identify and invite stakeholders to participate and kick off our strategic planning efforts. We hosted both virtual and in-person meetings. There were over 40 stakeholders who participated, which included residents from the community, hospital administrators, rural healthcare providers, payers, and University of Hawaii, and many, many others who dedicated their time and input. Concurrently, to help feed into and provide information into the development of the telehealth plan, we concurrently held focus groups in each of the counties, Hawaii Island, Maui, and Kauai. I personally sat with and talked with community residents, providers, administrators, and many others to gather their input for the state telehealth plan. Well, I will note that in talking with the providers, the number one cited barrier was a lack of reimbursement for telehealth. Another barrier was broadband connectivity. Either there was a lack of it on the patient side, or there was a lack of reliable connectivity to be able to do telehealth visits. For residents, in addition to broadband connectivity, it was just being informed about what to expect in a telehealth engagement, particularly patients or residents that have never had a telehealth visit. They wanted to know that they were being scheduled for a visit beforehand as well. And something that also surfaced to the top was this need for trust in the provider. Residents were concerned about engaging with non-local providers who were unfamiliar with our culture, as well as the ways in which we communicate in Hawaii. By 2019, the priorities for telehealth were clearer, and with the support and funding from our legislature, we began work in engaging our community rural healthcare providers and healthcare systems who can demonstrate telehealth focused on areas identified in the summit and planning efforts. So we looked at broadband connectivity and workforce development around community health workers, as well as identifying the challenges around reimbursement. We partnered with Auntie Jessie, who's the executive director at the Ka'u Rural Health Community Association, who was able to demonstrate the value of integrating community health workers as a part of the healthcare workforce. We also worked closely with the DCCA Cable Television Division to identify placement of hotspots in specific areas across the state. And with the help of Bert Lum, who is the state's strategic broadband officer located in DBED, Department of Business and Economic Development and Tourism, we were able to get introduced to key players in the broadband space. We were very fortunate to meet with Spectrum and Hawaiian Tel at that time to just learn the basics of their business model and their expansion initiatives. Between 2019 and 2020, we were able to execute a number of contracts related to telehealth pilots, which included Wahiawa Community Health Center, Ho'olahui, Hawaii, and Kauai, Hamakua Health Center, Kokua, Kalihi Valley, Waianae, and Lanai Community Health Center. At that time, none of these clinics did telehealth. They focused on training their workforce with a focus on being able to deliver telebehavioral health services. So prior to COVID, asking providers to do telehealth was like pulling teeth. Given the lack of reimbursement in rural communities, particularly amongst our federally qualified health centers who were not reimbursed at their PPS rates, knowing that they work with vulnerable populations in the community, we were really thankful to be able to contract with a few of the providers, a few of the FQHCs on the neighbor islands, to be able to work with them and identify some of the challenges there. So that brings me to where we are in 2020. In March, as you know, COVID really hit Hawaii and across the world. We ramped up telehealth engagements. It was super busy with all the changes, like almost daily by the hour. We knew that we needed to engage our providers in the community right away. And so we partnered with our Pacific Basin Telehealth Resource Center to form the Telehealth Hui. Thank you so much for Dr. Christina Higa and her team there to really engage providers in the community about the policy changes under the Public Health Emergency Declaration. So these changes now that we are seeing were really critical towards opening the doors around reimbursement for telehealth, which was cited as the #1 barrier for providers, particularly those that work at federally qualified health centers. And so groups that are participating in the telehealth Hui or who have been able to benefit from it definitely was the Native Hawaiian Health System, the FQHCs, Queen's Hospital, HMSA, Shriners Hospital, HPH, and private practicing providers. We all really learned from each other in participating in this hui, and we are thankful that our community really came together to address how do we provide healthcare services during this great time of need for COVID response. And so thankfully to Dr. Kelly Withy and her team at the Area Health Education Center, we were able to put out a contract to provide healthcare access and make available COVID-19 screening as well as behavioral mental health services. We are continuing engagements in our community focused on broadband and of course telehealth, but we are a part of the broadband hui who have actually really expanded in many ways. The focus now is on helping teachers and students to connect and identifying ways with our partners towards bridging those connectivity gaps. I'm also making interim updates to the telehealth plan as we go through engagements with our both of our huis, telehealth and broadband hui. So what's next for telehealth? From initial reports we were receiving from providers in the community with those that we've contracted and our engagements with the hui, what we're learning is that patient demand will continue post-COVID. Hamakua noted that 100% of their behavioral health services is now virtual, whereas before it was zero, no virtual engagements through telehealth. And Hamakua also noted that, you know, they recognize that if patients don't have the option of telehealth, they will go elsewhere, given the convenience. And now with COVID, having some experience and comfort around telehealth, patients want to be able to utilize telehealth, stay at home and not be able to drive. So it's certainly a benefit for patients. And what we're learning from the provider community is that this is also beneficial, and they're getting more comfortable with telehealth due to COVID. We are engaged with our federal partners to help provide input on establishing more permanent supportive policies around telehealth going forward. We are also looking forward for funding support around broadband in the state. We know that 5G is just right around the corner, and we know that we do have last mile areas in Hawaii to be able to, you know, bridge that gap of connectivity. It will bring not only opportunities, economic opportunities to the state, but it will enable us to bridge that gap in terms of healthcare access, as I mentioned earlier, with healthcare disparities. We are looking for funding and looking forward to funding for workforce development, education, and training efforts. And so I like to close up my presentation today. I have my contact information here, my office number and email. This concludes my presentation. Mahalo nui for the opportunity to present. I'll be here to answer any questions as well. Mahalo.